We wanted to check in because it's been a while since we've done a COVID update. And I'm going to hand it over to Director Bonds for the health-related portion of this, and then to Mike Piscatelli for some information on the economic recovery. But I did want to just start by saying thank you to so many New Haven residents and nonprofits for the work that has gone into making sure that we persevere during the pandemic. We've made incredible progress, and we're still not out of the woods, but when you compare the work that we've done to most of our counterparts in other large cities, we're doing quite well, both on the COVID recovery side, the vaccination side, and on the economic recovery side. That doesn't mean we don't have more work to do, and our team is working to make it as easy as possible for people to get vaccinated, and trying to find creative solutions to close that remaining gap of individuals that have not yet gotten vaccinated. But I just want to underscore how appreciative I am to the New Haven community for following the guidance, following the science, and I don't think we would be here today having had so much success if there wasn't this community engagement and support. So I'll hand it over to you, Director Bond. You're on mute.
Thank you, Mayor, for sending it off to me. And thank you all for joining us today. We want to just make sure that we provide, as you know, as the Mayor mentioned, we are in this recovery phase. Can you all see my slides?
Not yet.
Share, here we are. Cool. And
so Director Bond, we can see your slides and the notes.
There, are the notes gone?
There, it worked.
Okay, wonderful. So good afternoon, and thank you for joining. It was important for us at this pivotal time that we have launched our vaccination efforts in the last few months to talk a little bit about COVID-19 recovery and sort of like what does that look like for us here in the city of New Haven. And so, as you know, throughout this pandemic in the last 15 months, as a city, we made an asserted effort to really address this pandemic from a multi-sector approach, really looking at both the physical, social, and economic domains of the residents as a whole. And so we were very cognizant about making sure that we had our unified command meetings that consisted of all city partners. And then as we transitioned through the pandemic, including different community leaders and other partners to ensure that we are not only being transparent on what we were sharing, but also being inclusive with equity in mind. And so I'm happy to report that we currently have the lowest cases ever. So on top, you see where our cases have been for the past 2 weeks, which is about 38 cases. We're seeing about 2 cases per 100,000. And that is a significant change. So we are very proud of the work that we've been doing here in New Haven. And really, as the Mayor indicated, the fact that the community has come together and have been very responsive to getting vaccinated so that we can be able to normalize to regular activities. Overall, below is the chart of where we were as far as cumulative cases as a city, and we've made and come a long way. And so where are we as far as vaccination coverage? Oftentimes we've been on different news outlets and different videos really promoting and proud of the vaccination rates in our city. So in our city for first dose, we are at 61%, and fully vaccinated are over 55%. On the right of you, what you see is sort of one of the things that we utilize as a strategy. So on the right is our city and where we are in regards to vaccination rate by different wards within the city. And so really when we're trying to make decisions and we're trying to work on how are we going to ensure that access is not a barrier for vaccinations, is making sure that we provide data and make decisions based on science and data-driven facts. And so what you see is really something that we look at on a weekly basis collectively as a team and with our community partners, as including our alders, so that we can be able to collaborate on where we can then promote vaccination sites and education when we're doing outreach. And so this has been very vital for us in our decision making. And so how do we compare in regards to other cities? So I am going to brag just a little bit into our own horn that the city of New Haven is the leading city of other urban cities in Connecticut. I'm very proud of all of the work that has gone into this effort. And we are continuing now to work on really achieving a community herd immunity and really trying to get to 70%. So on an average, we're trying to reach about 23,000 additional people so that we can get vaccinated so that we can have community herd immunity. And what that means, because herd immunity, and I like to not speak in high terms and just really be herd immunity is how can we be able to have some protective factor within our community. And so we are working really hard on that effort. And so while I respect all of my community colleagues as health directors, I am proud of our community members for stepping up and getting vaccinated. And so what does community immunity look like? And this is just exactly what I mentioned, is really, the vaccines that are required, and so that we cannot pass infections onto others. And, we saw the fatalities and the untimely deaths during this pandemic. And our goal is to make sure that we do not have another loss of life when something is accessible to them. And so we just want to make sure that we're working with our partners on a number of efforts to ensure that we're increasing education as well as access to different vaccination sites. To date, we have offered over 155 vaccination sites in the community. We have done that through a number of ways, partnering primarily with Griffin Hospital, our New Haven Health Department clinic, as well as FEMA, which my colleague Rick Fontana will delve into. And so one of the things that we're doing that's going to be up and coming that's unique and different is that we are so happy to be able to partner with the Forbes gas station. This Saturday, we will be giving $10 worth of free gas for your first dose of vaccine. We will be having a youth vaccine event where nurses and pediatricians will be on site so that we can provide education as well as promoting vaccinations with free food, popcorn, and candy, and different incentives to be able to offer to our community. And then the one that I'm really proud of is my clinic director and my nurse coordinator, charge nurse, is going to be out at a barbershop pretty soon, and they're going to be out at a barbershop educating those individuals, the customers that were coming to get a haircut, and be able to answer questions. And so we're really proud of all of the partners that have come together, the pediatricians and local leaders, and most importantly, my clinical staff, who happen to be men and are able to share, share peer-to-peer about the importance of getting vaccinated. And just really quickly, we're at Longworth, also providing and support to our food trucks. We're giving out $10 incentives as well. We're at the beach. So those of you that are at the beach, I'm sure you have seen us. One of my favorite places to go to is Lighthouse Point Park. And so we're also out there providing vaccinations and also on the green as well. And so one of the things that is going to be up and coming is not only are we making sure that our website has materials that are culturally and linguistically appropriate and also with a health literacy in mind, but we are happy to have been a recipient of both a vaccine equity grant as well as a $4 million grant from the Office of Minority Health. And those two things are going to allow us to really develop a vaccine education campaign with influencers and other leaders that will be able to support this effort. And we also are going to do a Refer a Friend campaign where those individuals that have been vaccinated, they refer a friend and they will also be able to get an incentive. So many, many things happening. Continue to visit our website or call us if you have any questions or ideas, or if you want to partner with us. We are always looking to add to our team. And lastly, before I close, I just want to share just a little bit about the variant. So as you know, we are closely monitoring the Delta variant, which is the most recent variant that has been a concern both globally, nationally, statewide, and locally. And so we're closely monitoring that. Most of 51% of our cases were COVID-19 related. And right now we've seen statewide about 48 Delta cases that were sequenced throughout the state. And so one of the things that's really relieving for me is that the three vaccine manufacturers, both Johnson & Johnson, Pfizer, and Moderna, have all indicated that it does have protective factor over that. That's if you're vaccinated. So I just want to caution those that are not vaccinated to just, continue to practice good hygiene, continue to wear your mask if you're out in the community and not vaccinating, hand washing, and of course, social distancing and trying to avoid large crowds. And so with that, I'm going to turn it over to the mayor, and thank you. I will answer any questions after we are concluded.
Thanks, Director Bond. Adrian, do you want to talk a little bit about the efforts that we're making to promote more uptake in vaccinations?
Yeah, of course. So we're doing a vaccine campaign that's focusing on educating people about the facts of getting the vaccine and busting myths. So we're focusing on a Did You Know campaign that really combats those myths and the concerns that people have around getting vaccinated, specifically young people, and still a lot of communities of color who are really hesitant to take the vaccine. And so our approach is that we don't want to feel like we're forcing them to get the vaccine, but we do want you to make an informed decision, and we want to give you the education, like Director Bond said, health literacy, and making sure you have the facts, the information, so you can make that decision, but with all of the information in front of you. So this vaccine campaign is kind of like a spinoff of the Mask Up campaign, where you might remember we did the billboards, we had social media campaign. We're going to be focusing with this on videos and some billboards as well as social media. We're going to have two videos, one that speaks to the younger population. So anyone that's between 12 and 18 years old, or 12 and 17, that needs consent from a parent, how you talk to a parent about getting vaccinated, giving your parent the information that's out there so that your parent can help make that decision for you to become vaccinated. Then we're going to have a campaign that's specifically for 18 plus. And so that would be obviously for older adults and targeted to them. And also we're going to be translating all of this into Spanish so that the Spanish population has access to that. And we are looking at different languages that we may also be able to translate this into. We're going to be partnering with influencers again. That worked really well with the Mask Up campaign. I think that people really don't necessarily always trust, the government, or, even if it's trusted health sources, they may not view it that way. So we find that it's really, really helpful when you partner with local community influencers who are able to also talk about vaccination and bust those myths with the health experts. And so that's our focus. We'll be working with creative population, community influencers, health experts, Director Bonds and her department on this campaign, and you'll be seeing that come really soon.
Thanks, Adrian. And Rick, can you talk about FEMA?
Sure. Good afternoon. The FEMA Mobile Vaccination Unit is a unit that was provided through the Federal Emergency Management Agency. It's made 3 different stops in New Haven. It's on its 4th stop. It was meant to focus on the underserved population. So we centrally located it at the New Haven Green. We did that in May. We had it there for a couple of days. The 2 days we had it there, we were the highest in the state at 700 vaccinations. Then we brought it back again on the 6th of June through the 17th of June, and that was over at Edgewood Park. We've been very successful. There were 648 vaccinations that were completed over at the Edgewood Park. And again, if you look at the total number, again, this is really, a lot of teamwork in partnership with the Connecticut Department of Emergency Management and Homeland Security, the Health Department, along with FEMA, Yale New Haven Hospital, and Griffin Hospital. Again, just we're looking at about 3,000 total vaccinations to our underserved population. That was the focus here. It was a little bit different than utilizing the public health folks that were doing it in many of the other parts of the city. But again, central location, there were high vaccination rates. These were incentive based. So we had a DJ there. They were giving out food. We did some pizza on the green. We're doing, as recent as this weekend, we'll be doing a picnic in the park. Again, trying to encourage individuals to come out and get that vaccination. It's been extremely successful, but it has been a lot of work, and it does take, a partnership. Actually, yesterday was our first day back in New Haven with the FEMA unit at Edgewood Park. We did 201 vaccinations, which is a pretty large amount for one day. Out of that 200, we had 25 walk-ups. So again, we're going to continue to market the vaccination unit. This is the last time that we will see this unit in the state of Connecticut. It'll be here in New Haven from yesterday through Sunday. So we encourage folks who have the opportunity, who want to get vaccinated, to go over to Edgewood Park between 10 a.m. and 5 p.m. There's no wait. There's no appointment needed. Enjoy free lunch. Enjoy some good music. And again, our goal is to meet the demands of the underserved population. And this will be the last stop in Connecticut for the FEMA unit. So it's been a huge success. We've been told New Haven is the highest amount in the state. We're proud of that. But again, a lot of teamwork, a lot of hard work by everyone, ensuring that this was successful. And again, we appreciate everyone's hard work on the city side as well. So
Thanks, Rick. I appreciate it.
Yeah.
And appreciate your hard work because I know that's been a lot in your court. Mike, can you talk about economic recovery?
Sure. Thanks, Mayor. Thanks, everyone. Thanks so much for the support over the course of the year. It's such a good time to reflect at the, sort of the 6-month mark of 2021. I'll throw a couple of slides up on the screen just to give you a context setting as to, where we see things going and where we've been over the course of the year or so, and just also take a look not only at the indicators, but what are some of the fundamentals that are driving our recovery. And then we'll take a peek at some of the summer marketing campaigns that we see going forward. So as you know from some of our prior briefings, we've been staying focused on small business, bringing people back to work, both responsibly into the workplace or reskilling when necessary to workforce development side, and then supporting the great places of the city, not only on the economic front, but also just on social and the sense of belonging that we need here in our community. And you see that not only in the downtown, but citywide. Just in terms of the data and the indicators, we have a full report online. The April report is up now at togethernewhaven.com, and we'll have the May report just shortly. We excerpted a couple of slides just for context. One is the unemployment rate, which is down 1.4% in May, consistent with a nationwide trend as people come back to work. We're still looking at over 4,000 workers who are unemployed. That's down from over 5,700 continuing claims, which from our prior briefings and some of the ribbon cuttings, that number was up over 6,000 at one point. So good to see that number continuing to come down. I'd categorize the group that's still filing continuing claims about 4 major categories. Hospitality is one, administrative services related to the office workforce still filing a number of continuing complaints. Healthcare, and then retail as well. So those are focus sectors for us going forward. In terms of brick and mortar and storefront resiliency, we've been out counting both not only in the downtown with Town Green, but also in the neighborhood districts. We did a count in August of last year, and we did another one in April of this year. The overall vacancy, or number of storefronts that are vacant, went down by 13. We've counted 84 new brick and mortar storefronts since the start of the pandemic. 48 total for 2020, and a great pace for 2021 with 36 already to date. And online, we have that broken out by all of the major commercial districts here. In terms of filling those storefronts and generally supporting small business, there are a number of programs not only in the city, but throughout the community. One of our real benchmark programs is the Cultural Equity Fund, which if you have any questions about, Adrian is on the call and can talk a little bit about the next round of the Cultural Equity Fund that's going out. There is also our partnership loan program and programs in the community supporting the reopening of storefronts. Recognizing, of course, that we still have many people working from home, and this is a real opportunity to automate, we're retooling the marketplace. We've talked about this marketplace in the past. You know, people were at home or out of the area. This was a way to buy gift cards, let's say, to support a small business. We think there's another level to the marketplace, so we've retooled it, added more businesses, and added more categories. So now we've got an experiences category, as well as retail, and as well as restaurant, all to help small businesses create another revenue stream, if you will, that's lasting and not just pegged, say, against the pandemic and some of the shutdowns. In terms of outdoor experiences, I think everyone is feeling it around town. Over 430 outdoor dining seats right now. There was a real push earlier this year to make the permitting process a little bit easier, give people a little bit more flexibility. We supported, particularly through the grant from the United Illuminating Company, more and better outdoor street furniture. You see that all over town, just a whole different level of an outdoor experience. We've got one more street closed, that's Central Avenue in Westville. That was made possible through one of the CDBG CARES grants. So really pleased to see what the Westville Village Alliance is doing out in Westville. And that complements Orange Street and College Street, which were already closed, and again, moving to the next level. If people haven't been out to the Westville Music Bowl, I mean, it's not 10,000 people at a show, but about 1,900 per show. So it's a very comfortable and lively experience out at the Westville Music Bowl. That's also supporting the reopening of the hotel sector as we start to see the occupancy rate go back up. In terms of construction activity, we did 22 million in building permit revenue last year, a real remarkable number that we did for the fiscal year. That was against a base of 15.6 million in the prior fiscal year, which would have been fiscal year 20. And it runs the gamut, right? I think the highest profile is in the residential sector. The upper picture there is today at Chapel and Olive. That's one of 3 new neighborhoods that's going up here in the city. Chapel and Olive, 600 units. Audubon and State will be over 400 units when fully complete. And then a couple of weeks ago, we opened up the building on Prince Street, which is part of 600 units at the Hill to downtown. Now in fiscal year 21, it's not just the residential side, but also a significant commercial side as well. We've talked extensively about 101 College Street. We'll talk much more this year about Science Park, these 2 real anchors of our innovation district. And I just put some of the logos up here just to give people a sense of the sort of the fundamentals that are driving the construction growth and starting to see the recovery, if you will, come together. These are not name brand logos yet, right? But they will be in future years here in the city. We have over 40 biotechs now established here in New Haven. You also see Quantum Circuits over on the left there, the circle for Quantum Circuits, the new and next generation of computing technology. These are the companies that'll really drive growth going forward. And you see, particularly in the biotechs, as the announcements come out, as the science improves, it's truly inspiring as products go from an idea maybe on the bench at Yale School of Medicine to a product that's on the shelves. One that's on TV right now is called Nurtec, which is a product that comes out of Biohaven and supports people with really challenging migraine headaches, for example. The metrics behind that, in 2020, there were about 570 grants under contract from the NIH here in New Haven, and that's already over 370 million for fiscal year, for calendar year 2021. So another real good indicator of the growth in this sector. So taking a look forward, we still have quite a bit of work to do, particularly in the downtown as we reopen fully the commercial office sector. Yale opens on August 1st. So there's a lot of planning going into that. The next couple of days, you'll see the new video roll out. It's called How Do You Do New Haven? This was created by our small business team, led by Kathy Graves and Jerry Garcia, together with the team at Town Green Special Services District. I don't know how to play it, nor will I play it on the call today, but just kind of keep an eye out for the press release for it. And this will be part of the teaser, looking again at the experiences, the retail and the restaurant sector, not only in the downtown, but across the city. And the other big campaign that you're going to see rolling out earlier today, Market New Haven announced Summer Saturdays. So that again will be the 17th, 24th, and 31st of July. Those are the special discounts throughout the downtown, $20 fixed price for lunch and dinner, as well as the discounted rates for the parking. And that ties in with what Yale Properties is doing and supported by Market New Haven and Town Green, really to get people more comfortable coming back to all of the different stores. We're going back, right? That means new clothes, new gear for work. And this is all available in the downtown and in some of our neighborhood commercial districts. So keep a lookout for the marketing associated with that, particularly as Summer Saturdays rolls out later this July. So with that, I'm happy to answer any questions about these programs and some of the others. And as I said, the full economic report will be posted online for May at togethernewhaven.com.
Thanks, Mike. That's a lot to take in. Appreciate you putting that all together. Any questions from folks? Go ahead, Tom.
Thanks very much, everyone. So I guess for the mayor and for Director Bond, it's very helpful learning about all of those pop-ups, the pop-up vaccination sites taking place. But where can someone go if they don't necessarily want to chase a pop-up, but want to get vaccinated? Do they go to the health department? Is there another site that will definitely be doing vaccinations for the foreseeable future?
Yeah, absolutely. My closing remarks, I did mention the website. Not only can you get educational resources, but we have all the vaccination sites centralized there. I mean, Walmart, Stop and Shop, ShopRite, I mean, and all of the local pharmacies are pretty much offering it, which is phenomenal. So we have those listed on our website at newhavenct.gov.
Thank you. And for the $10 incentives of various kinds, have you found that these are actually working? I know that at least the Long Wharf food truck, you all have been doing that for a few months, I think. Does it work? Do people respond to the $10 incentives?
Well, people, I think people, for the most part, love incentives. A lot of the different, I love the San Francisco model. It's been definitely one of the best practices that we look at, effective in just being able to give incentives. We do assess it. We are dwindling down with people coming out to get vaccinated because of the number in the beginning. We saw a lot of interest, and I think it's dwindling down because we are definitely at a point, sort of getting closer to vaccinating a lot of the population that wants to be vaccinated. So that's why we're working towards having these education campaigns that provide unique incentives that people can also benefit from and utilize.
Yeah, I think different things work for different people, right? And that's why the initiative that Adrian's working on is another way for us to encourage more folks to get vaccinated.
Yeah, I had a quick question. This is Lisa Klein from New Haven Biz. Is the city doing anything specifically about the many vacancies along the Green and Chapel Street, especially around, right at the bottom of the Green? Thanks.
Mike, do you want to take that one?
So it's interesting. One of the trends we saw during the pandemic, and I think it may continue, is we lost a number of the chain stores. So Halal Guys was one of the ones that closed. Starbucks closed. One of the things Town Green is doing right now is to decorate those storefronts, put some interim uses in there. It'll take a little bit of time to refill all of them as the commercial office sector, the retail will follow that population as it comes forward. That's why we think it's very important to keep growing on the residential side to create another and bolster another base of activity to support those storefronts, particularly right in the central business district.
Thanks, Mike. Other questions? Go ahead, Tom.
One more, thanks. And it's about city staff, so probably for the mayor and Director Bond again. So what's the latest with city requirements for whether or not city staff have to wear masks or don't have to wear masks, have to return to the city hall at 200 Orange to work, or can work remotely. You can take the masks and where people are working.
Want me to take that on?
Yeah, sure.
Yeah, so, we contemplated with that decision collectively, of course, and because we are not able to ask people for a fact if they've been vaccinated, we want to make sure that we also think about the safety of our employees. So therefore, we're still in a place, and we're not quite at that herd immunity, that level that we want to be. And so we are still requiring masks within our city buildings. And of course, we will continue to assess that. But currently, we want to ensure that people feel comfortable, that they want to be able to visit the city buildings. And so we are going to continue with the mask adherence at this juncture.
Does that answer your question, Tom?
It does. And are you contemplating a vaccination mandate for city employees?
At the moment, no.
Thanks. That's it for me.
Yep. Any other questions from folks? Okay, good to see everybody. Thanks for joining. Take care.
Thank
Bye.
you.